pretty consistent influx of COVID patients, both who are coming in with COVID symptoms and those that are asymptomatic and are testing positive when they get admitted.
Dr. Nicole Sinclair is a pediatric intensive care physician and pediatric section chief at Covenant Healthcare in Saginaw. Sinclair tells us right now the number of pediatric COVID patients she sees has been steady.
I wouldn't say that we have seen the same influx as across the country. We know pediatric hospitalizations are up 48% nationwide with the Omicron variant. So it still may be coming our way in the future weeks and months.
Sinclair has noticed a change in the last couple of months, saying the young children she sees have more adult-like symptoms.
Respiratory symptoms, needing a high level of oxygen and support. We are still seeing cases of the multi-system inflammatory syndrome in children, which occurs 4 to 6 weeks after COVID infection. And they come in very sick, a lot of inflammation, skin rashes, vomiting and diarrhea, and high fever.
Sinclair tells us no children have died on the pediatric floor. She says all the children in her unit that have been hospitalized were not vaccinated. She is urging parents everywhere to avoid large gatherings, and that's not all.
Staying diligent on hand hygiene and wearing masks, and if your child is eligible for vaccination and or the booster, that we stay on top of that.
James Felton, WNEM TV5.
As for those school outbreaks, the state keeps an updated list. Now you can find it by going to the Hotlink section of WNEM.com.